An outcome measure for therapy refers to a specific tool or assessment used to evaluate the effectiveness and impact of therapeutic interventions. It provides quantifiable data and objective measurements that help therapists, researchers, and clinicians assess their clients' treatment progress and outcomes. The primary goal of therapy is to bring about positive change in a person's mental health, emotional well-being, or overall functioning. Outcome measures are crucial in determining whether therapeutic interventions achieve these desired outcomes. By systematically collecting and analyzing data, therapists can gain valuable insights into the effectiveness of their treatment approaches and make informed decisions about the course of therapy. They can evaluate symptom reduction, functional improvements, quality of life enhancements, or the attainment of specific therapeutic goals. To use our outcome measures, follow these steps. Download our outcome measures from the Carepatron platform, which you can find in the link in the description. Firstly, identify the outcome you want to measure. What do you want to know about the change that has occurred? Select an appropriate outcome measure. Many different outcome measures are available, so you must choose one relevant to your specific intervention and goals. Collect data. You must collect data on the outcome measure before and after the intervention. This can be done through the surveys, interviews, or other methods. Analyze the data. Once you have collected the data, you will need to analyze it to see if there is a significant difference between the before and after scores. Interpret the results. Once you've analyzed the data, you must interpret the results to see what they mean. This will help you understand the intervention's effectiveness and decide on future treatment. The scoring of an outcome measure will vary depending on the specific measure. However, some general principles apply to most outcome measures. First, the measure must be scored consistently and how it is designed. Secondly, the scoring should be reliable and valid. Thirdly, the scoring should be sensitive to change. And finally, the scoring should be easy to understand and use. Here is a sample of our outcome measures, which you can find on our Carepatron platform. To find our outcome measures, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.